We just wanted to give you a quick demo about how to get to the clinicaltrials.gov site, which is an FDA-sponsored site. It's where clinical trials are obligated to report their findings, and it's a tremendous clearinghouse of information. The website is in your book. It's clinicaltrials.gov. On one of the slides, on Jurgen's slide, as well as one of the slides for my presentation, this pathway is there, so you don't need to necessarily write this down step by step. You're going to go to, fingers crossed, Find Studies. I'm going to do a basic search, and of course, if you have time and the inclination, you can search further. I put the search term in myasthenia gravis. Hit enter. And it brings you to, there should be, or there were last time I looked, three pages of information. There's, looks like 2 pages now of information. If you go to one of the summary slides, one of my summary slides, you'll see a wrap-up of this. In short, there were, I think, 6 medication-related clinical trials. Would you like to look at one of them briefly? Yes? No? Oh, look at this. Safety and efficacy of, how do you say that? They're cool. Yeah, Regain.
Yeah, it's better.
Without going into a whole lot of detail here, you can get more information than you ever imagined for any particular study. The rituximab studies out here, a number of the other studies that Dr. Burns referenced yesterday are also out here. So out of 40 or 41 studies, there were 12 related to myasthenia, or 11 related to myasthenia that were actively recruiting. 5 of them were ancillary treatment, looking at ultrasound, EMG, a couple dealing with the role of exercise with myasthenia, and then the rest were medication related. So this being one of the medication sites. You can see a lot of the information that you had presented.
So, thanks, John. One point I'll just add, actually, is the information on clinicaltrials.gov, in addition to the description of the study design and the number of patients and the criteria for eligibility, it also provides information on sites that are participating in the study. So if we were to go to this, if I can work this at the minute, the mouse, under this tab here, there would be the study locations. You'll find that for any clinical trial, frankly, but again, if it's one you're interested in, it will list all the sites, should list all the sites that are participating in the study, so that you would be able to determine if there's a site that's close to you. And in fact, if you found that there wasn't a site close to you, there's a tab where you can write for more information, because often you will find in clinical trials, what's captured in clinicaltrials.gov is the existing trial sites, but often there are more sites that are continuing to be opened. So it's information that's been constantly refreshed. And so if you were to reach out, you may find information to say that a study's actually even been planned in your area.
Before we start the Q&A, I'm going to ask Dr. Ruff to give a little overview. Having spent a lifetime treating myasthenia, it'd be interesting to get his perspective.
So I think that, first off, that, as was said, clinical trials are essential in terms of determining what works and what doesn't work. And often a trial may be negative, but that's useful information because there may be a folk belief that a certain intervention works, and in fact it turns out not to. For the myasthenia community to advance closer to finding a cure for myasthenia, people need to be willing to participate in clinical trials. The concept that I think has changed greatly over time is that people in clinical trials are guinea pigs. And in reality, the protections that are present in clinical trials that you would access through sites such as the government NIH website are overviewed by a number of processes. One is the institutional review board associated with the trial. Another is the people administering the trial. And the third is that after the trial is completed, the findings go under further scrutiny by a professional community. You participated in a trial, and how do you feel after having done that? Or you at least thought about it?
Yes, so I did not participate. I was looking at the rituximab phase 2 trial. I ended up not participating in it. There was a reasonable, in hindsight, a reasonable explanation of risks and benefits, but I can tell you that despite my quasi-rational approach to things, as I subtitled one of those slides, all rational thought flew out the window with the possibility of this drug that offered hope. So I think that the really important point in informed consent is not present, yes, you have to present the data. You need to know that what you're participating is safe and how safe. But we need, and I don't have a good way to do this, we need a way to translate that data into meaningful information that's meaningful for each patient where they happen to be. So information that's relevant to you and to you and to you and to me in our particular points of our lives.
So I think that's an excellent point. So one of the things when I do clinical trials, I do them in primary, I do an exercise trial, I participate in the clinical trials. One of the things I do in my informed consent process is I review all the data. And I say, I don't want you to sign on here until you're ready to go. So what I ask people to do is take the consent home, discuss it with their family, their friends, and most importantly, take it to their primary care and their neurologist. And I think that's how you get that feedback. Is this right for me? Because then you get, maybe your doctor was planning on adding something from a clinical standpoint that's already available. And then you discuss clinically risk-benefit of whatever their plan was plus the clinical trial.
I think it's important that when people are thinking about a clinical trial, if you're really enthusiastic, but more importantly, if you are desperate, if you feel as if this is sort of your last hope, that you discuss it with somebody who has, let's say, less emotional association with the process. And so your care provider is a good person, be that a neurologist or somebody else who is helping you through myasthenia. And I think in general, those people really are serving as guides for you. They're helping to direct which way you go. I encourage people to consider clinical trials. I don't think anybody should force a person into a clinical trial. This is not like buying a timeshare condo. You don't make a decision. You don't want to make a decision on the spot. You do want to think about it over time. It's not something where if you don't make a decision immediately, it's going to go away. If it's a reasonable trial, they want you to consider carefully what's going on. But the consideration that you need to be aware of is that in the initial phase of the trial, you may not get the active substance, the active intervention. You may get the placebo intervention. And in many trials, at least today, there is a second phase where after the code has been broken, if it turns out that the intervention seems to be efficacious, that people are offered the opportunity to cross over and take the active agent if they were on placebo. So it's not a guarantee that it's going to work. There are risks to it. The information, you should consider that it not only may be helpful to you, but that the process is helpful to the larger community of people with myasthenia.
I agree with everything that was just said. I would add to that I think the most difficult to deal with as a potential participant is the uncertainty. No matter what the investigator, what they tell you, they also tell you how little they know. No matter whether it's an early phase 1 study where we really don't know anything about information about this particular intervention, or whether it's a phase 3 like the Regain study where they have already tested eculizumab in other diseases it's approved, there's a lot of points, and you have to accept. The biggest unknown obviously is we do not know whether the drug works or not. That's why, number 1, the study is done, and number 2, why we test it against placebo. So if you cannot handle uncertainty, then it's very difficult for you to, with emotions, to come up with any decisions. So just be aware that as you listen to the investigator tell you what's known about the drug, what's known about alternative treatments, and whatever else, always appreciate the fact there's lots of things that are unknown, which is the reason why we do this study in the first place.
This is more directed for John, and I forgot your name from Regain. But this has to do with before the person signs the consent. I work mainly with children who were in about 10 or 12 clinical trials at the hospital. I work in Chicago. And I noticed with the Regain, because I can't say that word, Luzumab or something, EMAB I'll call it, they say to get a meningococcal vaccine and all that because it'll decrease your immune system. I was wondering, in a couple of trials we had, hindsight is always 20/20, but there were some kids that were getting tested for for clinical trial, and they ended up, 2 of the kids fractured their feet in the study because, prednisone, brittle bones, all that. And I almost wish, like in your study where you said, get the meningococcal so you don't get sick, I almost wish as anticipatory guidance, we would tell these parents ethically, don't let your kids go in those bounce houses for 6 months while you're on this trial. Or don't let your kid go something like, I don't know, soccer or somewhere where they could fracture. And in your study, do you get them to also, on that note, do you also get them to have TB testing or flu shots or pertussis or anything like that? Because I'm just thinking, like, ethically, there's so many other things that could kill you. And, or is it just the meningococcal?
So first of all, thank you for the question. And I realize actually it's probably a double whammy. One is the pronunciation of my name. It's an Irish name, Roisin. And the second half of that double whammy is the eculizumab. If it's any comfort, I joined Alexion about 18 months ago, and when I was going through my interview process, I avoided at all costs trying to use the eculizumab. Okay, so to the question you've asked on the Regain, specifically, I'll come to the end. It is meningococcal only vaccination. But one thing, just to speak a little bit more broadly, is during the trial, and part of that information that's gathered in that screening period around the medical history and other conditions that you're experiencing, etc. That information is all very important and is captured. Because as we progress clinical trials and as you come back for your visits and are speaking with your physician and your neurologist, part of in addition to the blood draws, in addition to the assessments such as the QMG or the ADL, a very important component is also how have you been doing? Have you been experiencing any other effects? Is there been anything that's been troubling you? And that's very, very important because that's where we capture the safety information, which all gets reported, and frankly, which obviously can get reported in the label as well. So. Succinctly, one, for the REGAIN trial, it's purely the meningococcal infection. Things happen in clinical trials, even a headache. Is the headache because you haven't taken coffee, because you've taken too much coffee? But it's something that's happened in the clinical trial while you are receiving blinded treatment. Report. So that way we can really get the complete picture, is maybe not the best word, but the sense on the effects that are potentially associated with the treatment. And because then the trial is blinded and half are receiving the active, half are placebo, doing the analysis of the data and comparing the two groups enables us to derive and see what potential effects are being caused by the drug.
I apologize if maybe this is redundant, but I may have missed it. For young women who are in the childbearing ages, how does that affect them? And then I had a follow-up to that.
For the REGAIN trial, one of the criteria before entry is a pregnancy test and the exclusion of pregnant women from the trial and the practicing of contraception or birth control during the trial as well.
Then my second question is kind of maybe a more general one. How does insurance go? Is it up to the individual's insurance to cover the cost of the trial, or does the trial itself take care of any costs that are associated with it?
So again, I'll just for ease speak out to the REGAIN trial. So Alexion, being the sponsor, is responsible for the costs of the trial. So the treatments, the follow-up, etc. Another component is recognizing that you're coming to the clinic is, you may have large distances to travel, and by virtue of the trial may have to come more frequently. Those costs are reimbursed as well. And so where I mentioned for the REGAIN trial where it's an add-on trial, in other words, stay on the existing therapy, my understanding is that that's covered by your existing insurance. That would continue to be covered by the insurance.
The doctors here would probably say I'm foolish, but if I could get an adult version, a human version of the vaccine being developed at the University of Pennsylvania today, rather than waiting through phases 1, 2, 3, I would take it today.
Tom referred to some information that Dr. Burns shared yesterday that had been in the literature probably 4 or 5 months ago. There is a early development vaccine that a couple researchers at the University of Pennsylvania are working on that showed great promise in rats. It is a large leap from working in rats to working in people, and thus the reason for the phases of a clinical trial. However, you know the clinical trial is coming. You know where the clinicaltrials.gov website is, and you know the names of the researchers. So there's information that would enable us to reach out to say, I'm interested.